Hey everyone, Suzanne here. I want to talk to you today about vaccines. Very important. As most of you know, and many people in my clinic, I'm a physician assistant. Many of my patients are coming in now asking about the COVID vaccine. Am I going to get one or not get one? What's the scoop? Well, let me tell you and give you some history on vaccines. And this was given to me by an infectious disease doctor years ago. She was incredibly brilliant. She trained at one of the top-notch universities here in the United States. And she explained it to me this way. She said, Suzanne, every year you get the flu shot. She said, now the flu shot lasts for about 3 months. So she said the best thing to do is to get the flu shot. She said, and again, before I say anything more, I always want you to check with your doctor. This is not medical advice. This is just for educational purposes only. Do not do this. Check, never change your treatment plan unless you talk to your doctor. She said to me, the best time to get your flu shot, since it only lasts for 3 months, is about Thanksgiving to December 1st. She said that way you're covered for basically the flu season, December, January, February, and the beginning of March. So she said, if you get your shot then, she says, what do I mean by it only lasts for 3 months? Well, when you get the flu shot, you're going to rev up something called antibodies. Okay? Now, after about 3 months, which is typical around the end of February, maybe the beginning of March, she said, what you want to do is you want to start hanging around people in your exam room who are flu positive. She said, because if they're flu positive and they're full of the virus, they're going to keep revving up these antibodies that disappear. And we all know that. We know from the news, they talk about this, that antibodies not necessarily last forever. But as the virus comes along, it just revs our system back up. A lot of you have asked me, why don't you get sick? How do you stay healthy all the time? It's because I've got these antibodies and I run toward people with the flu throughout the season instead of running away from people with the flu. Many patients will say, I got the flu shot in October. Here it is March, and they're positive for the flu. And they want to know why. Did the shot not work? And I said, no, the shot worked great, but your antibodies only last so long, 3 months. And if you don't keep revving them up by being around and out in the crowds with other people, you're not going to have the antibodies you need when you are around somebody who's infected. They're going to disappear. That's why every year we have to get the vaccine. Now, let's go to the COVID and talk about that. COVID's very interesting because we don't know, first of all, how long it's going to last. Okay? But we do know that the healthcare workers, such as myself and the hundreds and thousands of nurses and doctors out there in the healthcare system will get the COVID shot. We'll get it. We will get it. And the reason we'll get it is because, number one, this is what we do. All right, we want to stay safe, but we also want to prove to you how safe it is. And we have a little history to guide us with this, okay? So what happened is in 1954-55, there was something called polio. And polio was a virus, and it jumped from person to person. In fact, my Aunt Georgie woke up one morning and she was paralyzed from the waist down. My mom said it was a horrible disease because you never knew what family it was going to strike, and it only usually hit just one person in that family. You just never knew. Well, 1954-55, we came out with the polio vaccine. And there were 4 companies that made this vaccine. 4 companies. What they did was they killed the virus, killed it properly, took the recognizable parts or the antigens, the surface of it, injected it into people so the antibodies could start forming and people could be safe. Let the body do its natural thing. The problem is one of these 4 companies did not kill it correctly. 3 did. And that started us down the path of not trusting vaccinations. In fact, I think it was over 200,000 people either became paralyzed or died because of this one company not doing it correctly. Well, of course, our government jumped on that and our government fixed it immediately, but not after 200,000 people were affected. And then as people started to not want to do vaccinations anymore, and the liabilities against any side effects of vaccinations were getting so huge, the vaccination companies in the 60s and 70s said, we're not going to do vaccines anymore. We're done. We're not going to do them anymore. It's too liable for us. We can't afford the suits. So in the early 1980s, the government stepped in under Ronald Reagan and said, we're going to take the liability. We, the federal government, will take the liability for any side effects anybody gets from vaccines. But you have got to make vaccines. As manufacturers, you have got to make these vaccines. Because you take something like the measles, 95% of us in the population have to be vaccinated against measles. It's so highly contagious that it would wipe us all out if 95% of us didn't get it. So we have to have it. The flu vaccine, we usually have about 35 to 50% of the population gets it. The virus is not as contagious. The COVID vaccine, we don't know about, but we do know at least 60% of us do need either natural immunity or get the vaccine so that we can get back to normal life again. Ebola, we don't have to worry about. Ebola, we have a vaccine, but Ebola is not spread through the air. Ebola is spread through fluids. So you'd have to go touch the person with Ebola if you wanted to get Ebola, which I doubt you do. But that's not very contagious, so we don't worry about it. That's why it didn't affect us like it did other countries that didn't know any better. So why do I tell you all this about vaccines? Is because we're going to take the hit first, okay? We in the federal government are going to go get vaccinated against COVID. Now, don't forget, when you see me walking around and I don't have a mask on anymore, you've got to ask yourself, did that person get vaccinated and that's why she's not wearing one? Okay? So, I'll get the flu vaccine around Thanksgiving. I'll get the COVID vaccine as soon as it comes out, and I'll let the federal government keep me safe because I know they can. Take care. We'll talk soon. I hope this helps. If you have any questions, leave your comments below or send them to me, and be sure to get the Patient Best Medical History book so you've always got safe health care.